These are the steps of perio charting. First thing you'll do is write your patient's name at the top. You'll then put the first visit date, and your name as the first clinician name if you're using this form for the first time. The next thing you're going to do is make sure that you cross out any missing teeth. If you have missing teeth and you leave them in, it's going to make you get off in your charting. Sometimes patients have missing wisdom teeth, so if they do, you're going to cross off the teeth by placing an X through the boxes, the tooth, buccal, and lingual boxes. You could do that on all of the wisdom teeth. Sometimes patients also have missing first premolars. They're sometimes removed during ortho. So if they are, then you should also cross out those teeth. You might not notice it as you are working, but your numbers will be off everywhere if you don't catch that in the beginning. You're then going to tell the person who's charting for you exactly where you're going to begin. In our sequence, we follow 1 through 16 buccal, so you'll write left to right with the numbers. Then we go 1 to 16 lingual. Watching carefully on the bottom, we then go 17 to 32 buccal and 17 to 32 lingual. Now there's a lot of boxes here, so let's look at what they are. The first one is first probe date, so you should put the same date there. You have a line for probe depths and a line for cal. Next one, you're always going to start writing your first boxes will be the ones closest to the teeth. First probe depths and a line for cal. Then you'll see this line will be used next, followed by this one. Sometimes I'll tell students to highlight the row that you're working on if that makes it easier for you. The form does have repeatability, so the next time the patient comes in, whether it be 3, 4, 6 months, you can use the second probe depth line and write in these boxes on the same form. So let's say you're beginning just as normal, wisdom teeth and first premolars are missing. You'll tell your recorder, I'm going to start on tooth number 2. There's 3 numbers in each box, so you're going to have your distal buccal reading, your straight buccal reading, and your mesial buccal reading. On the lingual, you'll have your distal lingual reading, your straight lingual reading, and your mesial lingual reading. So if you say, I'm going to begin tooth number 2, distal buccal, and then you'll call out your numbers. You should try to call those out in groups of 3. You'll probably be pretty slow, so as you probe, you'll probably be probing, we'll just say 3, 2, 3, but you want to call out 3, 2, 3. That makes it easier so that the person charting for you always knows which 3 numbers go in which box. So let's say we started on tooth number 2, we're now on tooth number 3, distal buccal, 3, 2, 3, 2, 2, 2, 2, 1, 2, 2, 1, 2, 2, 2, 2, and you just keep moving. When you get to the mandibular arch and you're ready to start in the sequence that we've identified, your numbers are going to go backwards. You're going to start probing at the distal line angle of the tooth, work distal, reinsert distal line angle, and work mesial. So your numbers are going to be called out 3, 2, 3, 3, 2, 3, 3, 2, 3, and you're going to write them backwards like that. 3, 2, 2, 2, 2, 2, whatever the numbers might be. One way to look at this chart and remember how it's used is that you can imagine that the tongue is in the middle. So we have buccal, lingual, lingual buccal. Then also pay attention if you have numbers that are 4 millimeters or greater, they need to be written in red. So let's say you're starting again, tooth number 18, distal lingual, and you have 433, 434. You'll also be calling out bleeding. Bleeding should be charted by circling the number. So you would want to call out to the person recording for you, I have BOP on the distal lingual of tooth number 18. That would signify the person charting for you to circle that number. If we say there's bleeding, distal and mesial, tooth number 19, we circle those two numbers. Exudate is something you might find when probing also, and if you do find it, it needs to be circled in blue. So let's say that you have 635, and you have bleeding and exudate on the distal lingual of tooth number 22. You would circle that in blue and in red.